So here I'm going to show you how to access the PACU records on patients that we're caring for in the PACU. I noticed that it's not in there by default in the doctor's setup for Powerchart, or the Surginet incarnation of Powerchart, at least here, which is what we use primarily. So I felt that it was very important to have access to this because I asked the PACU nurse where they write their records, and they said it's in this iView ins and outs. And I came here and I looked and I said, okay, well, here's some I's and O's and whatnot in my iView, but there's no records about the PACU. And if I have a patient I'm caring for there and I want to see what happened in the PACU leading up to an event or something like that, I had no way of looking at it. So I asked them how to get access to it, and one of them was kind enough to show me. And in this video, I will show you how to do it so you know. So what you need to do is you need to go up here to View and then down to Layout. And what these are called here is Navigator Bands. So you want to click on the Navigator Band session, and this little dialog box comes up that allows us to pick which Navigator Bands are on our iView thing. So basically, these are the ones that I have access to currently, INO and the Advanced Graphing Band. But these are the ones that are available in the system that I can access. So what I can say is I want to access all of the PACU ones. So what I do is I click on the one I want here until it's highlighted, and click this arrow here to add it over there. And then I'll click all the ones that say PACU I think I'm going to be interested in. And you can click multiple ones at a time here and move them over. And I think there was one that was called Pre-Op Quick Chart, Pre-Op System Assessment. So that they're probably things that I'll be interested in as well. And there was one that was about blood transfusions. I've always had trouble finding where they document the blood transfusion information, and the answer is it's in this iView. So I can add this here. So I've moved all these over here, and I will now have access to them over in my iView band over here. Now these are in the order in which I added them, but they're not necessarily the order that I want them. So I can click on individual items here and move them around using these up and down arrows. So in this case, I think that I'll put blood transfusion up top because that's something that I might want to see on a regular basis. And then there's this pre-op system assessment. I think that that's probably pretty important too. And then I have my pre-op quick chart, which I'll put under that. And then if you notice, the multi-select is on, so I can also select things here, but it does not allow me to move them if I have multi-select. So what I'll do is I'll just move these up individually. Unfortunately, it's a little bit of a pain. You have to unclick the one you already worked on and then move on to the other one, but it is what it is. So now these are in the order that I'm kind of interested in. So I can click OK. Now this little dialog comes up saying I have to restart the application for my changes to take effect. So I'll click OK. The nice thing is you don't have to actually restart all of Surginet or Powerchart. You just have to close the patient and then reopen the patient. So I'll come back here, ZZZ test, and I'll go back to little Miss Gina here. And when I come back to her, under my menus here, come to iView, now all the things I put there are there. So now I have access to whether or not the patient was transfused, how many units, whatever. Here, it'll tell me down here all the different things, vitals that go along with that, the blood products that were actually given, a pre-op system assessment, and then a quick chart, which shows a bunch of different things. And then all the PACU stuff, system assessment. So you can look back and see what happened leading up to any event in the PACU that you were interested in. As always, if you like this video, click like below, and you can always subscribe to my channel for more like this in the future.